good morning or afternoon or noon, depending upon where you are. My name is Keith Hansen, and I'm with the Association for Healthcare Emergency Preparedness Professionals. I'm the executive director of this brand new organization. And first of all, I want to thank you all for being on the line. I appreciate it. The other voice that you've heard is Michelle Kassmeyer. She's actually our IT genius and the person that helps run our website and these webinars. She does a fantastic job for us, so I'm excited to have her on the line also. And I want to thank you for being here and for your interest in the association. As I said, this is a brand new association. We've been around almost exactly a week, and our mission is really to help healthcare preparedness professionals to do their jobs better and better and better. One of the things, all of us in this association have a background in healthcare or public health emergency preparedness. So as time came on and went by, we found that there are things that are readily available and things that aren't, and what we hope is to help fill the gap with this association. It's taken about 5 years for us to go from here's an idea to launch. So it's taken a while, and that's okay. We've had a lot of time to think about what people need, what we needed when we started in this field. And that's really what this is based upon, is our history and the history of other emergency preparedness professionals. So our first foray into non-hospital conferences and education was in 2013 when we sponsored a national long-term care conference. We've also done a lot of conferences in the past, but this is really the first time we branched out beyond hospitals and into long-term care. And since that time, we branched into other areas, home health, all types of folks that are working with basically CMS recipients or recipients of CMS and Medicare and Medicaid funds. So the history is really that we wanted to make this organization very useful to the members. I am personally a member of other organizations that I don't get a lot out of. That is not what I want from this organization. I want this to be very hands-on for people that want hands-on. I want this to be educational for people that want education. I want this to provide skills for people that are new or want to enhance skills. So I think the strength of our group right now is that we've been in the trenches and we know what people in the trenches want, and some of us are still in the trenches and we listen to people that have good ideas and want to make everybody better. So let's go right into this. Some of the benefits of being a member is that we've gotten a reduced rate for founding members, and some of you may already be members. We started that at $125 for an annual membership price. $50 for students because students are broke. Again, we've been students too, so we recognize that. But one of the things you'll notice is that for founding members, and actually even people that join after June 1st, you'll get your money back out of this organization really quickly. I mean, really quickly. Just for members, we're going to have 6 free educational webinars per year. So your membership pays for itself before you're even, by the time you're done registering. So if you attend those free webinars, you'll get your money's worth out of it right away. We're really excited. I probably can't confirm this, but we're 90% sure that in January we're going to be able to have Dr. Phil Smith conduct a webinar for us. Dr. Smith is the head of the University of Nebraska Medical Center's biocontainment unit and the individual that treated the Ebola patients for all 3 of the Ebola patients that came to Nebraska. And he's a supporter of AHEPP, the Association of Healthcare Emergency Preparedness Professionals. And not only is he a supporter, but he's willing to actually do one of our first webinars for us. So we're really tickled about this. And I know none of you have met Dr. Phil Smith, but not only is he a good doctor, he's a heck of a human being. So we're really tickled to be working with him. Another benefit is that we're going to have an annual conference. We've been to a number of annual conferences. I've been personally PowerPointed to death. I've been subjected to panels that were uh, very helpful and some that weren't. But what we want to do is make our annual conferences as beneficial as we can. So we intend to include things like skills training and other types of things that people are going to be able to get their hands dirty and walk away with more than just a handful of PowerPoints and a book. So we've done a lot of training in our history, and we're familiar with what people want and what they don't want. And one of the strengths I think we have, another of the strengths we have, is that we really listen to the people that come to our stuff, and we modify it every time we do it, almost to a fault. So we're excited to do that annual conference. Online resources. What we want to be able to do is be a one-stop shop, maybe not one stop, but we want to provide a lot of resources for you online. One of the people that we work very closely with is on the Hospital Incident Command System, the National NHICS group. And she's also one of the authors of the HICS for Rural Hospitals. So those things, I think those are already on the AHEPP website, as a matter of fact. The other thing that we're going to provide on the website is a lot of information that you may not see elsewhere. I think one of the benefits of having an organization or an association is that you're able to go to one place and see more and have access to more information than you would if you were out there trying to find it all yourself. It's just a time saver, which is what I found. We also are really excited about some online community networking. I've been a member of listservs, and I think some listservs are fantastic. I've gotten a lot out of them. I have, over time, though, preferred to pull my information rather than have it pushed to me. So that's a personal preference, and we're absolutely able and willing to set up a listserv if people want that. But I've discovered, and a number of us have discovered, that we're much happier if we're able to go out and get information rather than get those 30 emails a day, especially when people start replying to the entire listserv multiple times. So we're really excited about the online community, the networking possibilities that are going to be possible. And I think especially, and I don't know how many of you are actually in hospitals and how many are not. One of the things that we have in this organization is we've broken it into 5 different groups. We want these groups to be beneficial to specific people. What we've noticed is that there are a lot of people that a lot of resources are directed towards hospitals. And many of those resources are directed towards large hospitals. So small hospitals kind of struggle with how to scale some of the information and some of the requirements that we have. And some of this doesn't apply at all to long-term care or home health or assisted living facilities. A lot of those people that need disaster response and disaster preparedness plans, but they aren't affiliated or they aren't responsible for any kind of community response like the hospital is. So what we've discovered is that people are going to want different. They want to talk to people that are in the same boat as they are, and that's one of the opportunities we're going to provide people with this online community and some of this online networking. Continuing education. We tend to offer continuing education for most of the things we do. We'll do that for the webinars. So if you are an RN, you'll be able to, not only will that $125 membership fee get you the 6 hours of education, it'll get you 6 CEs for nursing, because we tend to like to provide that. Most of our audience historically has been nurses. However, if we discover that there are other fields that need CEs or want CEs from these opportunities, these educational sessions, we will absolutely find out how we can provide that to people. We don't do a lot of CMEs, which are the continuing medical education, mostly for physicians and those types of folks, psychologists, because those are fairly expensive to put on, and historically we haven't had a lot of people join us for those. We tend to cater more towards the ground level folks and the people that are getting their hands dirty like we do. So we don't tend to do a lot of that for physicians and dentists and those types of things. However, we can if people are really interested in that. Leadership opportunities. We are really interested in doing some leadership. Sanitarians, nice. Environmental health, good. Okay, good. I just spoke to a bunch of those folks in Iowa, as a matter of fact, not too long ago. That was fun. So mentoring and contributions to AHEP's annual conference. What we're looking for is people that are on the ground and people that are doing this every day and people that are not only succeeding but failing, for lack of a better way to put it. Those of you that are involved in exercises know what I'm talking about. If you do an exercise, you're going to find out stuff you didn't do as well as you want to do it next time. So one of the things that we want is for people that are doing the work to contribute to the conferences. We will absolutely have researchers present because we think best practices is also important. We will absolutely have physicians and PhDs talking about the research because the research is important. Our slogan is moving preparedness forward. We need that research. We need that best practice literature to be able to take the field in its next step. So we will have that. But I'm also really interested in the people that went through the Ebola patient that walked into their ED, or the person that had the MERS patient in Florida, or whatever the case might be. Really interested in having those people tell their stories because everybody learns a ton from those. So that's good. Some of the stuff that we're talking about for the future, for upcoming, publications is one of the things we're going to put out. We are very interested and we're going to communicate through e-newsletters, through other communications that we will push out to people that want it. And if they don't want it, they just opt out and it won't be sent to them. But some of that information we feel will be best off being pushed rather than all of it being pulled, but you have control over how much you want pushed. Advocacy. One of the gaps that we've discovered and ran into in our careers is that there are lots of national and state organizations that are pushing out requirements that are not either possibly not necessary or especially burdensome or just don't make sense. So one of the things we want to be able to do is to provide some advocacy on the federal level for people that are in this field. We don't feel that there's a whole lot of that right now. There are pockets of it, like for instance through APIC, the Association of Folks in Infection Prevention. They do some of that, but their real gig is infection prevention. And if it happens to coincide with or overlap with preparedness, then they will advocate, but they're not looking out for that. We want to be able to look out for areas where we can have a voice for people that are in this field. Another thing that I think Michelle will probably not go into in much depth, but it's an option on our website, and we'll talk about it a little bit right now, is job postings. As we move forward, there will be a place on our website for people to post positions and go out and look for other positions. So we want to be a little bit of a clearinghouse for that, especially for people that are in this field and want to stay in this field but are moving to a different geographic location or are looking for somebody to hire. We want to be able to serve that need. Conference scholarships. We feel it's important for people that don't have a huge budget to still be able to get continuing education. So we're looking for vendors and corporate sponsors that will help provide scholarships to conferences that or trainings that we put on. It's just important to be able to do that. We don't want this just to be for people that have a big budget, which is why we've only set a $125 membership fee. But we want people to be able to attend regardless of their corporate budget or their income level. And the last thing that we do, and this is a little novel for an association, we're going to do some innovative and novel research. Some of us are housed in a university, and so that's of interest to us for one, but the other thing is that if we really want to move this field forward, we really do need to be able to say this works and this doesn't work and this works better and this is a way to tweak what's going on or how you're doing this. So it's important for us to not only review and post research that occurs, but we want to be able to conduct some of our own in areas that we feel are important for the progression of the field. So I'm going to let Michelle take you through a tour of the site.
Hello. Okay, so I'm going to go ahead and switch gears here and we'll go ahead and show you some of the things on here. So this is our homepage. And you can see right up here at the top is the contact us. If you ever need to get a hold of us, go ahead and click that and it'll take us or take you right to a page where you can do that. Also up here at the top are the Twitter and LinkedIn icons that you can click and it'll take you to those platforms. And most of you, or several of you, are probably part of our LinkedIn group, which has about 1,400 people in it already. And we post a lot of stuff in there right now. And Twitter, we're becoming a little more active. Also, you'll see on this homepage are the Twitter is our Twitter feed, so you can kind of see we've been posting a few things, and you can follow or comment right here on this page. So that's kind of interesting. And then right up here at the top are all of the events. So if you're ever looking for any future events, you can click this events tab, and it'll show you everything that we've got coming up. So like Keith mentioned before.
Did I just take you off? I'm sorry, I'm trying to mute this.
Oh, there we go. Sorry about that. All right, we're back. Okay, so on this events page, you can see everything that's coming up. And like Keith mentioned, you can see that in January 28th, we will be having Dr. Phil Smith that is going to speak, and the title of that is Ebola Screening, what to do when your patient answers yes. And so we're pretty excited for him to be speaking for us. And then you'll see that we already have dates for our AHEPP annual conference for next November. Also under this event tab, something for members, or if you go to this webinars, you'll actually be able to see any of the recordings. So these were some kind of first webinars that we did, and by clicking recording, it'll take you to where you actually have to sign in to be able to view it. But those will all be posted here for the time being, and then you can actually register here on this page for the upcoming webinars. I'll get the one for January up here later today. Live trainings, we are actually going to postpone this until February, but this will be where you'll get to see kind of a list of everything that'll be going on as far as live trainings, if you're looking for something more specific as opposed to all of the events going on. On this membership tab right here, you'll see the fee structure for our members. This is also where you'll be able to, on this Join AHEPP, select which type of member you want to join as, and be able to click here, member, and continue, and it'll take you through the registration process and ask for your payment of $125. And one thing to note is that we actually do have the ability to bill you so that we can send you an invoice and you can send us a check or pay us a little bit later rather than putting a credit card in right away. So we're sort of catering to our audience so that they can have several options for submitting payment. Another thing that is on here in this membership tab are all of the member benefits that Keith went through just a bit ago. So you can see those here listed out also. The next tab here is the resources tab. So you can see all of the resources that we've got online currently. And we do have the Nebraska Medicine and UNMC PPE resources for donning and doffing for when you're treating an Ebola patient. Eventually, we will have a tab for members only to give some resources to those of you who become members, and those will not be available to just the general public. And you'll actually have to sign in to get those. Currently, we don't have that list yet. We're still compiling and sorting and all of that. This next tab, job postings, is kind of what Keith mentioned before. It's pretty new, and on this public site, you can't see much of anything. We're still in the process of collecting those and figuring out the best way to display these and how to collect them from some of our members. So that's coming soon, but this is where that will be. In the About Us tab, you'll get to see, here's a picture of Keith, Christy, myself, and Becky, and some of the information about ourselves. And then you'll also see our email addresses listed here. So if you've got any questions or a specific person you'd like to talk to, you can go there. Our mission statement, and here's another place you can find the contact us. And then of course you can click either this home button or the icon and it'll take you back to the home page. So that's everything that you can see before signing in. Once you sign in, the website will look a little bit different. So I'm going to go ahead and sign in as if I am a member. So you can sign in this sign in box right here, and it will take you to your profile home. So it gives you some of the information about yourself, and you can actually edit those things right on this page. Another thing is, or actually the most important thing probably, is to know where this manage profile is, because once you hit that manage profile, that'll kind of take you to the space where all of the events that you've registered for, you can click events registered for, and it'll give you a list. So you can kind of get an idea of what you've registered for and more specific information there. And you can see that this webinar today is listed on here, and if you click that, it'll take you to the event page. So to get back to where we were, again, this member profile, and this is also where you can edit your preferences, and that is your email preferences. You can also edit your information here, your job information. So if you change jobs or get a new phone number or any of that information, this is where you'd enter that. Also on this page, you can find your membership card. So we think this is pretty cool. You can actually print this, and this will actually be sent to you upon paying your dues. You'll get your membership card, and you can print this on your own, and it's got your name up here. Test member is the user account that I'm using now. Your membership number, member type, and it'll also give you when it expires. So you'll have that. So that's kind of cool to keep. You can also find your invoices on here and what you any bills that you need to pay. So on here, when I created this test account, that's why it zeroed out to 0, because this is for our use so that we can see exactly what you're seeing. And so you'll see the total, the balance, and then you can actually go ahead and look at the actual invoice on here too and print from this screen. So that's pretty easy to find. So we'll go back to this manage profile, and then some of the other things on here are messaging and groups and stuff. We're still in the process of creating these groups and how best to use them, and we'll probably be doing some more informational webinars on how to actually utilize these groups and how to sign up for them. So that's kind of more information to come later also. Another thing on here is refer a friend in this my profile box. You can send an email directly to a coworker or a friend and give them information about AHEPP if you think that it'd be a good association for them to join. So if you've got somebody in mind, please help us out since we are new. Go ahead and send this information to your coworkers or friends or anyone you know that might be interested. So that's kind of the back end about what you see when you're a member right now. And again, we'll constantly be updating and adding new things, and we'll let our members know that as they become available. And I think the last thing that I want to talk about that I am seeing I missed on the home page is that on our home page, if you scroll down towards the bottom here next to our Twitter feed, you can actually see the latest news. So we are going to keep posting articles in here, and these are actually sorted by title. So it says News and Press Ebola, and that's the box that you would have clicked in, and then Ebola in the news is the topic, and then within that are 3 different articles that we've posted, and it'll take you to the actual websites. So that's kind of everything there. And then also on the homepage, of course, is the calendar in a snapshot, so you can see what events are coming up, and clicking on any of these will take you directly to the event page, and from the page you can register. So that's kind of our website and what it looks like now, and we'll constantly be updating and adding new things. Be sure to check back to the website. And I guess I do have one other thing too before we wrap up. Don't forget future events. These are also on our website that I kind of just showed you. We're going to be doing exercise design, and it'll be focused around how to do exercises for treating Ebola patients or something similar to that. And then we'll also have that webinar that I mentioned on January 28th, and then of course the annual AHEPP conference. And these are all on the website. And then I wanted to go ahead and give you our contact information here so that you can have that. And then, well, thank you all. We appreciate you listening in today, and go ahead and keep emailing us and keep checking back to the site for new things. And we hope to hear you on next month's webinar with Dr. Smith. Have a great day.